So there's a few things we'd like to do from a technical perspective, from a surgical perspective, to create the perfect sleeve. The perfect sleeve should allow you to lose weight, should minimize the risk of weight regain and pouch dilation, and should also minimize the risk of post-operative reflux. So here's a patient we just completed. It's a nice long stomach. A few things that we did to make sure that the sleeve was perfect. The first thing we always do is we start stapling now about 3 centimeters from the pylorus. The pylorus is the valve between the stomach and the duodenum. So we actually size it to make sure we're 3 centimeters away from this valve. Now, some people tend to start stapling much higher up, and that can be a problem. It can create a large pouch, which could result in not losing enough weight. So we typically start about 3 centimeters from the pylorus. The second thing that often we see is people staple too far away from this area because they're worried about obstruction. So they tend to staple like this. And they create a little bit of a pouch. And this pouch could potentially lead to stretching of the stomach. So what we do is we stay flush, completely flush on the bougie throughout the entire staple line. We don't kind of move away from the bougie here because we're worried about obstruction. We stay really completely flush along the bougie to create that perfect sleeve. The other thing that we do is we mobilize a structure here called the gastroesophageal fat pad. And by doing that, we expose this area better. Because we have our bougie in place and we've mobilized this fat pad, we can staple really close to that gastroesophageal junction, leave about 1 centimeter. And that actually creates a nice tight sleeve, but we don't impinge on the esophagus because you don't want to actually staple the esophagus because that could lead to a leak. So by just leaving 1 centimeter from the esophagus and the stomach, we increase the amount of stomach that we've removed, and we prevent this area from dilating in the future. One of the last steps is the actual last staple line. What we've done here already before is to mobilize the GE junction fat pad. That's this fat pad over here. We've already peeled it off the stomach. That allows us to get really close to the GE junction, or the junction between the stomach and esophagus. And that allows us to minimize the pouch higher up in the sleeve, and I think probably leads to less reflux and less dilation of the pouch proximally. So there you go, that's our last firing, and then we'll be able to see the complete sleeve. There we go, so we're right on the GE junction. That's the fat pad, just about 1 centimeter away from the esophagus. Some people are a little bit hesitant to go too close to the esophagus, and they leave a big pouch over here. So by mobilizing that fat pad, we can get very close to the G junction. Obviously not too close because you don't want to be stapling esophagus, because that could certainly lead to some leaks. You take the bougie out now.